The vascular tree to describe the progressive change in vessels as we move away from the heart and closer towards individual cells, and then from individual cells back to the heart. Each section of the vascular tree has different identifying factors to it that allow it to perform its function within the cardiovascular system. The closer to the heart that you are, the larger the radii of the vessels. So veins and arteries have greater radii than arterioles and venules. Arteriole and venules have greater radii than capillaries. The further away you move from the heart, the greater the surface area. Capillaries have the greatest surface area, followed by venules and arterioles, and then veins and arteries. Each branch of the vascular tree has a certain role. The arteries are in charge of being a pressure reservoir. The arteries handle a high pressure. When the left ventricle contracts, it has to generate enough pressure to overcome that of the arteries. It also has to handle enough pressure that allows that change of pressure from start to end to propel the blood all the way through the systemic system. Therefore, blood leaving the left ventricle can be equal to 90 or greater millimeters of mercury pressure. These arteries are highly elastic and are very thick with the ability to recoil. Arterioles' key role is to control cardiac output. Arterioles are able to change radii and therefore determine which organs receive more or less blood flow, and also how much resistance the cardiovascular system endures. The role of the cardiovascular system is to perform exchange. However, exchange cannot happen in the arteries because of the thickness of the vessels, nor in the arterioles because of their thickness of vessels. It is not until the blood reaches the capillaries that exchange of oxygen, carbon dioxide, hydrogen, or any nutrients can actually occur. So remember, capillaries equal exchange. Exchange cannot happen anywhere else. By the time the blood reaches the veins, blood pressure has significantly dropped. The veins have a large ability to extend or serve as a blood reservoir. The first branch of the vascular tree is the arteries. The arteries serve as a pressure reserve. They act as a driving force to the blood to ensure that blood flow is able to reach all the way back to the heart. They are highly compliant. This means that they are easily stretched and are able to return back to their original shape. This high compliance is necessary due to the alternating contraction and relaxation of the heart. When the heart contracts, it sends a surge of blood into the arteries. This volume of blood is greater than what can drain off into the arterioles during that same amount of time. Therefore, there is a buildup of blood in the arteries during systole. The ability of the arteries to expand during systole to hold onto the blood allows time for the arterioles to continuously provide the capillaries with blood flow. It also prevents blood from getting backed up and having to go back into the heart. The increased volume during systole allows time for blood to slowly flow from the arteries into the arterioles without increasing arterial dissension. During diastole, there is time for the increased volume occurred during systole to drain off and allows the arteries to return back to their original position. During diastole, the blood is able to slowly flow into the arterioles and allows the arteries to return back to their original starting position. This is due to a large amount of elastin fibers, smooth muscle, and a large connective coat built mostly of collagen that surrounds all arteries. This heavy reinforcement allows it to expand and handle these large increases of pressure and then recoil back to its original shape. If you try to take your pulse by your neck, you can actually feel the surge of blood running through the artery and the alternation between systole and diastole. The pulse, which we take to indicate a heartbeat, is actually the bolus of blood that is being inputted into the artery. It pulses again. That's the bolus of blood surging into the arteries, causing an increase in volume, and then the slow decrease in volume during relaxation. The arteries also serve as the interstate of blood delivery. Arteries serve as a rapid disbursement of blood to all the organs of the body. Arteries are too thick to allow for exchange to occur. Their radii is large to decrease resistance, and it quickly branches to all the different extremities and organ systems within the body. Because resistance is low, blood flow and the velocity of flow is incredibly high. Arterioles are the second branch of the tree. They offer major resistance, especially in comparison to the arteries in which they adjoin to. This resistance is caused by their small radii and small number. This resistance causes a drop in blood pressure. Average arterial pressure is around 93 millimeters of mercury. By the time the blood reaches the end of the arterioles, blood pressure has dropped to around 37 millimeters of mercury as it enters into the capillaries. This significant drop in blood pressure causes two things to happen. The first thing it causes to happen is it continues to push the blood downstream. If blood pressure didn't drop between the arteries and the arterioles, blood flow would also stop. Due to the drop in blood pressure, this allows blood to quickly flow from the 93 millimeters of mercury to the 37 millimeters of mercury. This significant drop causes the blood as it enters into the capillaries to be much smaller. There is less force being exerted onto the capillaries. Arterioles are significant because they can change their radii. Their change in radii offers the ability to vary blood flow to the organs to meet the metabolic demand of each organ system. This also allows the body to maintain overall blood pressure. Arterioles are able to control radii due to the increase of smooth muscle surrounding the vessel, which is richly innervated by the sympathetic system. Under normal conditions, there is some vascular tone due to some sympathetic stimulation. At rest or during normal conditions, there has to be some sympathetic stimulation because the parasympathetic system does not dual innervate on the arterioles. Or there is no way to counter what the sympathetic system is doing. So if at rest there was no sympathetic stimulation, we would not be able to vasodilate the arterioles any more than what they were done at rest. When an organ needs an increase in blood flow, the arteriole is able to vasodilate, which means to expand the amount of blood flow through that vessel by increasing the radii of the blood vessel. This is done by decreasing sympathetic stimulation. By decreasing the sympathetic stimulation, the muscle around the vessel relaxes and expands. For a moment, make a fist and squeeze as hard as you can. This is what's done during normal vascular tone. We have a force that's squeezing inward. Now relax your hand and let it open up. As we decrease stimulation, there begins to be a widening or an opening of that vessel, similar to opening up and releasing your hand from a grasp. When we need to decrease blood flow to an organ, vasoconstriction can occur. Vasoconstriction causes a narrowing of the blood vessel due to increased stimulation by the sympathetic nervous system, which causes increased contraction of the smooth muscle tissue. If you think of a boa constrictor gets its name by how it kills its food. It wraps itself around an animal and squeezes until that animal no longer can breathe anymore. It slowly narrows the pathway for breathing. Vasoconstriction is the exact same thing. Vasoconstriction results in a narrowing of the vessel due to increased stimulation by the sympathetic nervous system, causing the smooth muscle to clamp down further on that blood vessel. This narrows the pathway for blood to flow, increasing resistance and thereby decreasing blood flow into that organ system. How do the arterioles know which organs need more blood flow compared to which ones need less blood flow? The arterioles respond to local changes in concentration and pH. Any agent that indicates an increase in metabolic demand of the tissues connected to their arterioles are going to cause a vasodilation. Common causes or common indicators of higher metabolic demand would be lower oxygen concentration, higher hydrogen concentration, an increase in nitric oxide, and an increase in carbon dioxide. In contrast, tissues that demonstrate lower metabolic demand are going to cause an increase in vasoconstriction. This would be high oxygen concentrations and basically the opposite of everything else listed. Extrinsically, our body can respond to overall releases of sympathetic stimulation. If we receive a bolus of epinephrine or norepinephrine, this is overall going to increase vasoconstriction to the entire system. The ability to vasodilate and vasoconstrict makes sure that all the organs in the body receive the amount of blood and nutrients that they need relative to their metabolic demand. If, for example, we are exercising, we are going to see an increase of vasodilation to the skeletal muscles most active during the exercise. We will see a vasoconstriction to all the organ systems that are less active during this activity, specifically the digestive system. As we continue to generate more heat from our exercising muscles, we are also going to have to vasodilate to our skin. At that time, the body is going to have to make a decision whether to continue to vasoconstrict to the digestive system or begin to vasoconstrict to the skeletal muscles. The ability to vasoconstrict and vasodilate essentially allows for the body to increase or decrease flow to various organ tissues by offering various resistance. The tissue most active is going to be the most open or have the greatest vasodilation. The tissue that is least active is going to be the most vasoconstricted or have the lowest blood flow. Tissue that needs to remain relatively active, such as the brain, is always going to maintain that moderate blood flow through its vascular tone. As we begin our discussion about capillaries, it's important to remember that all arteries, arterioles, capillaries, venules, and veins have a constant flow rate of about 5 liters per minute. This ensures that no blood is backed up at any part of the system and that the heart has adequate venous return in order to meet cardiac output demands. What does change, depending on which area of the vascular system you're in, is the cross-sectional area. As you can see from the graph, the arteries have the lowest cross-sectional area, which increases as you move to the arterioles, and then maximizes at the capillaries. It then progressively goes back down the curve through the venules and the veins. The effective cross-sectional area is important when we talk about velocity. The larger the cross-sectional area of a vascular branch, the slower the velocity of the blood as it travels through that branch. The slow velocity seen in the capillary system is advantageous because it allows for maximum time for exchange to occur between the blood and the tissue. If the blood traveled through the capillary system quickly, there would be less time for diffusion to occur. Another important factor to consider when looking at the capillaries is the alternation of pressure generated by the heart. As you can see in the left ventricle, pressure fluctuates quickly between 120 millimeters of mercury to 0 millimeters of mercury as the heart alternates between contraction and relaxation. As that pulse moves into the arteries, we still have an alternation between relaxation and contraction. We measure our blood pressure from artery blood pressure, usually the brachii artery. This is indicated by the systole and diastole of those alternating pulses of 120/80. As the blood moves into the arterioles, the vessels of resistance, there is a rapid decrease in pressure, but there is still an alternation between contraction and relaxation. This fluctuation of pressure necessitates that these vessels have reinforcement to deal with these pressure fluxes. By the time the blood reaches the capillaries, we no longer see that fluctuation in blood pressure and have one pressure exerted onto the capillaries. The drop in pressure, as well as no longer having the pulsation between pressure, means that the capillaries do not have to have the extra reinforcement of smooth muscle tissue or elastin or collagen around them in order to withstand the force of the pressure. You can also see by the red line that then blends in to the blue line in the capillaries, venules, and veins, the mean pressure. The mean pressure is the average amount of pressure exerted on the vessels because diastole takes a longer amount of time in comparison to systole, and therefore the mean pressure is lower on the graph than splitting them in the middle. Blood flow is dependent on a pressure gradient. As you can see, pressure in the vessels slowly drops as the blood moves from the left ventricle all the way to the vein. This increasing drop in pressure provides the driving force to move the blood throughout all the vessels back to the heart. Capillaries are ideally suited to be in charge of exchange. They meet all the requirements of Fick's law to ensure adequate diffusion. First of all, capillaries are composed of a single flat layer of endothelial cells. This decreases the distance between the plasma and the cells. The lumen of the capillaries is incredibly narrow. This causes the red blood cells to have to squeeze into them single file. There is not much room for plasma to fit into the capillaries along with the red blood cells, which exerts a pressure on the capillaries to ensure that plasma is forced out of the capillaries into the extracellular fluid. In addition, the distance between any capillary and the cell is incredibly small. It is no more than 0.01 centimeters away from any cell to the capillaries. Capillaries have an increased surface area compared to all other branches of the vascular tree. There are anywhere between 10 to 40 billion capillaries within our body. Proportionally, they also hold a small amount of overall blood volume. Finally, as the blood moves through the capillaries, they have an incredibly slow velocity. Even though the flow rate, the total amount of blood going through the capillaries at any one time, is 5 liters per minute, the amount of time that the blood is in a single capillary is exponentially larger in comparison to the arteries. This is because of the increased surface area. It would be like having a river, and that river connects to a lake, and then the lake connects to the same river on the opposite end. The lake allows the water to slow down due to its increased surface area. The capillaries act as this lake. The venules and arteries act as the river. The river would push the water quickly into the lake, where it then slows down due to the increased surface area, and then increases its velocity as it moves to the other side of the lake to the other river outlet. Similar is the capillaries. The arterioles push the blood quickly into the capillaries, where it is then slowed down by its increased surface area and then sped up as it continues to converge on less and less venules. If you look to the top left part of the board, you'll see that every capillary is formed with one single layer of endothelial cells. These endothelial cells direct contact with the endothelial cells to the left, right, top, and bottom of them. In the apexes where the epithelial cells meet, there are small pores that are filled with water. These pores allow for small water-soluble molecules to move in and out. Whether or not a molecule moves into the capillary or out of the capillary is dependent on the concentration gradient between the plasma and the extracellular fluid. Small water-soluble molecules include sodium, potassium, glucose, and amino acids. Lipid-soluble molecules like oxygen and carbon dioxide are able to diffuse directly through the endothelial cells. Large exchange proteins are able to move out of the plasma by using vesicle transportation. This is where the endothelial cell will engulf the exchange protein, transport it to the other side of the endothelial cell, and then release it. Plasma proteins, which stay within the plasma. These plasma proteins are very important in transporting waste and other hormones throughout the body, and also are important for maintaining an osmotic gradient. Because blood is consistently reconditioned by the lungs, the kidneys, and the digestive system, the plasma is able to maintain concentration gradients to facilitate the diffusion between the blood and the surrounding cells. Again, as cells become more metabolically active, this increases these concentration gradients to ensure that adequate transportation or adequate diffusion occurs between the cells and the plasma. Another way that nutrients and molecules are able to move from the capillaries into the interstitial fluid is by bulk flow. Bulk flow is non-selective and allows anything small enough to fit through the pores to move from the capillaries into the interstitial space. If the movement is from the capillaries to the interstitial space, this is called ultrafiltration. The pores are a two-way door. So anything that can move out of the capillaries can also move back into the capillaries. One factor that influences bulk flow is capillary blood pressure. On the arterial end of the capillaries, blood pressure is around 37 millimeters of mercury. By the time blood has reached the venous end, blood pressure has dropped to 17 millimeters of mercury due to increased friction by the red blood vessels against the capillary walls and the loss of fluid through the pores of the capillaries. A force that would force fluid back into the capillaries would be interstitial fluid hydrostatic pressure. This is basically the pressure from the interstitial fluid exerted onto the capillaries. Hydrostatic pressure is around 1 millimeter of mercury. Just like diffusion, there's always movement in both directions. However, the net movement is going to be whichever force is greater. In terms of hydrostatic and blood pressure, on both ends, we can see that capillary pressure is greater than hydrostatic pressure So net movement in both cases on the arterial and the venous end due to capillary blood pressure would be outward into the interstitial space. Besides capillary pressure, the other force that can draw fluid in or out of the capillary is plasmacoid osmotic pressure. This is essentially the concentration of plasma proteins found within the capillaries. The capillaries are pretty much impermeable to plasma proteins moving out of the capillaries. They can move out during bulk flow, but the amount is relatively small compared to the amount that is kept in. As plasma is pushed out of the capillaries, as plasma is forced out of the capillaries, plasma proteins become more concentrated within the plasma. This causes osmotic movement of water from the interstitial fluid from the low concentration of plasma proteins towards the higher concentration of plasma proteins. The net flow of water back into the capillaries due to osmotic pressure is 25. Looking at the impact of both capillary pressure and osmotic pressure, we can determine where net flow is going to be outward versus where reabsorption is going to occur within the capillary. There is an outward force of 37 millimeters of mercury pressure on the arterial end of the capillaries. However, this is countered by an inward drawing force from the interstitial hydrostatic pressure of 1 millimeter of mercury and a 25 millimeter of mercury osmotic pressure due to the plasma protein concentration within the capillaries drawing fluid back into the capillaries. This means on the arterial end, there is a net movement of 11 millimeters of mercury forcing fluid out into the interstitial fluid. On the venous end of the capillary, we see a different story. Again, due to capillary blood pressure, there is a force of 17 millimeters of mercury forcing fluid out of the capillaries into the interstitial space. However, this is countered by an inward pressure of 1 millimeter of mercury by the hydrostatic pressure of the interstitial fluid, as well as a 25 millimeter mercury pressure due to the osmotic pressure due to plasma protein concentration drawing fluid back from the interstitial space into the capillaries. If we subtract the 1 and the 25 from the 17 of outflow, we see that there is a -9 force. The negative sign represents that the force pushing fluid back into the capillaries is greater than the force pushing fluid out of the capillaries. This means that there is a net reabsorption occurring within the capillaries. What is the effect of the net movement that we see on both ends of the capillary? On the arterial end, we see an outward movement of 11 millimeters of mercury compared to 9 pulling fluid back into the capillary system on the venous end. This results in a net capillary movement of fluid of 2 millimeters of mercury out. Remember that this is not an all or none. There is a gradual decrease in the outward forces as you move down the capillary tube, and then a transition point where the forces become inward. It's a slow shift from maximal movement outward that gradually a decrease in capillary pressure. This decrease in pressure is needed in order to maintain the pressure gradient and allow blood to continue to move through the capillary bed. A couple key takeaways on bulk flow. If we add up the outward and inward forces of bulk flow, we have a net output or a net ultrafiltration of 2 millimeters of mercury. Remember, bulk flow is not selective. Anything in the area that can fit through the pores within the capillaries can be pushed out into the interstitial fluid or can be brought back into the capillaries. Bulk flow is not impactful on nutrient delivery or waste removal. However, bulk flow is impactful on maintaining plasma volume. If our plasma volume becomes too great, we will have a higher pressure at the beginning of the capillaries and therefore will push out more fluid into the interstitial space. This allows plasma volume to remain within its normal range of around 5 liters. On the other end, if plasma volume drops, the pressure at the beginning of the capillaries will be lower and less fluid will be pushed out into the interstitial space.